Hello and welcome to Skin News. I'm Dr. Joshua Fox, board certified dermatologist and Mohs surgeon at the Miami Center for Dermatology. And today we are fired up to talk to you about seborrheic dermatitis. What is that? So this is a somewhat unorthodox type of video, because usually I like to summarize a quick medical journal. But today I'm just going to give you some basic tips while I'm here on the road in traffic trying to get home. So a very common complaint that patients bring to the office is what they call dry skin that they have in the eyebrows and around the nose in this area over here. And they call it dry skin, and it looks kind of pink and flaky and scaly. And if I can get my son to put in pictures of it into the video, that would be nice. He says it's really easy to do. So hopefully he'll help me out with that. But basically, you can look it up online, called seborrheic dermatitis. And that is a fancy name for dandruff, basically. You can have it on your scalp, you can have it on your face, you can even have it on your chest or your lower back. And essentially, there's a yeast called Malassezia furfur, and that yeast likes to eat oil. And the oiliest parts of your face are the central areas, like so, and as well as the eyebrows, and therefore that's where you find the seborrheic dermatitis very often. It can also be in the ears, by the way. And this yeast likes to eat oil, and it breaks down those lipids into metabolic byproducts that are inflammatory for the skin, and that causes the skin to get pink and flaky or scaly. So people see that and they think that their skin is dry, but really their skin is oily. And they keep putting oil and oil on there, and what they're doing is just feeding the yeast. So what you need is stuff to combat dandruff. And very often we'll prescribe a cream called ketoconazole 2% cream, and you can apply that to the areas twice a day, and usually that clears it up. And it's a chronic condition, so it could come back. So, you know, if you can use that cream maybe even once a week, sometimes that's enough to keep it at bay. Very often, seb derm, we'll call it for short, can get worse under stressful conditions. And that's prescription. But over the counter, you could theoretically try anti-dandruff shampoos as a face wash, such as Nizoral 1%, which is over the counter, or selenium sulfide or pyrithione zinc, which can be which are, you know, Head and Shoulders, Selsun Blue, and so on. And you can try those shampoos in the area. Sometimes shampoos can be a little more irritating for the skin. And of course, all this information is purely educational, and you should always speak with your healthcare provider before treating or diagnosing any of your medical conditions. But basically, those are some quick tips for seborrheic dermatitis. Thanks for tuning in. And remember that dermatology is more than skin deep. Please feel free to leave comments or questions down below in the comments section. We'll see you soon at Skin News. Take care, and bye-bye.